Dr. Yesh Navalgund is one of the country's most respected authorities on interventional pain management. The founder and owner of a large independent pain practice in Pittsburgh, Pennsylvania. He serves as president of the Pennsylvania Pain Society and as a faculty member at the Rockefeller Neuroscience Institute. We recently spoke with him about the use of technology in managing pain.
Well, I think that as you look at medicine in general, technology has become an important aspect of medicine, but particularly important when it comes to managing pain. At the Rockefeller Neuroscience Institute, we recognized this a few years ago and spent a lot of time trying to develop technologies such as wearable devices and other monitoring devices to look at how we can better control pain. One of the things that really came to my attention was the use of virtual reality as a means of managing pain. And it's been 25 years that the attempt to use virtual reality to manage pain has been around. But what we discovered is that the earlier thoughts about virtual reality was it was the virtual reality by itself that was the sole component that relieved pain or was attempting to relieve pain. What we did realize over time, however, is that just monitoring and just watching over patients' vital signs and things like that wasn't sufficient. And so we recognized that we need to try to incorporate some clinical care and clinical aspects of care into the treatment along with the technology. The way we look at that is that you simply can't provide somebody with some new technology and say, I'm going to eliminate your pain, because pain falls under a number of categories. There's the bio component, which is the actual pain itself. There's the social component, which is the effect on family and loved ones, things like that. And then there's also the psychic component, which is the effect on the patient's self, as far as depression and other things that go along with it. When you bring the technology together with remote clinicians, the advantages that you afford yourself is that the remote clinician can monitor, record, and assist the patients through the process. So while, again, the technology helps manage and control the pain, the additional support afforded by the clinician allows the patient's social situations to improve, as well as their own personal psych situation. I was first introduced to the VX therapy a couple of years ago and was very skeptical about its benefits. But after using it on several patients over the past few years, I've become a believer and feel that my patients substantially benefit from the therapy, and I've seen a tremendous reduction in opiate use by way of VR therapy as well. Over the years, we have discovered that it's clear technology is important. Technology will afford us the ability to improve patients' lives, but without the complement of having remote therapy as well as remote clinicians, we simply can't achieve our goals, which are lifelong improvement in the overall well-being of our patients.
Harvard MedTech, the visionary solution to pain.